I'm going to go through some important surface anatomy for the shoulder. And what I have already drawn out here, the clavicle, the coracoid process, the lesser tubercle, and as he turns around here to the side, you can see an outline of the spine of the scapula as it turns into the acromion process. And so these are some important structures that we're going to use. And so I'm going to go through how to palpate and how to find these structures. So the first thing that I'm going to look at is the coracoid process, and what you can usually feel in most patients is a concavity here along the ventral edge of the clavicle. If I go right in that little space, that little fossa, and I go straight caudal, the first bony point that I'll hit is the coracoid process, and that's what I have outlined here. What I can do to confirm that I'm on the coracoid process is I can place my finger here on the coracoid process, which is deep, and then as I internally and externally rotate the humerus, I shouldn't feel any motion. If I feel motion, if it's moving underneath my finger, then I'm probably a little bit too far lateral when I'm on the lesser tubercle. But here's the coracoid process here. It's a little deep. Okay, and so this is a really important structure because I'm going to use this to help me locate the orientation of the glenoid when I perform mobilization techniques at the shoulder. The other thing that I'm going to look at is just lateral to the coracoid process is the large lesser tubercle. So it's a pretty prominent structure, and what I can feel if I'm on the lesser tubercle, as I internally rotate and externally rotate, I'll feel movement underneath my finger. That's the movement of the lesser tubercle, moving medially as I go in internal rotation and moving laterally as I go into external rotation. Okay? The other thing that I can locate is the joint line for the, tip forward a little bit, the joint line for the acromioclavicular joint. Here is the anterior V, which you'll basically feel a little indentation here where the border of the acromion comes into contact with the clavicle. There's my anterior V, and then here on the back, if I follow, let's turn this way a little bit. If I follow the superior border of the spine of the scapula right around, I'll fall into a little space here. That's a posterior V, and if I can connect the two V's, the anterior V with the posterior V, this gives me the joint line of the acromioclavicular joint. Okay. The lower border of the spine of the scapula will continue around and find another very important point, which is right here. This is the posterior corner of the acromion. So it basically goes here from the posterior and it turns, and here's the lateral edge of the acromion. But the posterior corner of the acromion is really, really important for us from a manual therapy perspective, an assessment perspective, because here, I'll draw an X there, between the, if you can tip your shoulder this way a little bit, you can see that if we draw a line connecting the tip of the coracoid with the posterior corner of the acromion, this gives me an idea of the orientation of the glenoid. So anterior and posterior for the glenoid is here. It's running dorsal and lateral to ventral and medial. So here's the orientation anterior to posterior of his glenoid, going from the posterior corner of the acromion to the tip of the coracoid here anteriorly. Let's sit up. So those are our bony landmarks. Okay, stop it. Let's see, did I get it? 'Cause I had them